Today we're going to be talking about the learning tree, which is a DIR floor time model. This was developed by Stanley Greenspan in 1979. The Greenspan approach is an intervention that increases communication by symbolizing experiences. Floor time is actually the technique in which the clinician follows the child's lead while assisting in initializing and maintaining purposeful behaviors. DIR stands for D, developmental, I, individual, and R, relationship based. And they're all the building blocks of development, the biological based differences, and enabling the progress with relationship with others. This approach is a child-oriented approach that is designed around the child's strengths and weaknesses with the purpose of building a good foundation for social, emotional, and intellectual skills. Here you see the learning tree. The roots symbolize individual processing capacities. The soil symbolizes the nurturing intervention. And the trunk will be more like the difference of level of thinking, more like developmental levels of function, emotional. And the branches is academic skills, which is what makes the child an individual.
So first off, we have processing capacities, and that involves a child's ability to stay calm and focus. If dysregulated, the child may be over-responsive or under-responsive to stimuli. Therefore, the child may be unable to control their behavior. If the child is over-responsive, they'll need help in calming or organizing tasks. If they're under-responsive, they'll need arousal, attention, and intentionality.
Here are the roots, which takes care of the regulation. Regulation is sensory modulation, integration, motor planning, visual spatial processing, auditory processing, and emotional modulation. Sensory modulation and integration is when they take the sensory information from the environment, such as the auditory, tactile, visual, and vestibular and proprioceptive input, and they integrate it into an appropriate response. The problem that they have is that they have difficulty learning from the environment due to the either hypermobility or dispensiveness, or maybe they're not filtering the input. Our goal is to balance them. In order to do this, we need to have an understanding of the child's sensory profile, and this is when the speech therapist needs to have intercommunication with the occupational therapist to see what the child has. Some of the modulation and integration activities that we could do is the start and stop activities such as red light, green light, or maybe musical chairs, sensory bins, identifying objects like putting objects inside a pillow. As you do this, all the language is incorporated in all activities. Stuff that they could do is follow directions or maybe ask for categories, taking turns throughout the game, etc. Motor planning is the ability to have an idea, come up with a plan, and execute the plan motorically. For example, you realize that you're thirsty, then you get and ask for a glass of water, and then you drink the water. Children that have issues with this, that they cannot plan or execute or even ask for help, and then they become frustrated. If we do it for them, then they do not learn the ideation, plan, or execution pattern that they need to have. Our goal is to teach them to plan and initiate. Motor planning activities that you could do is it's activities that you could looking or doing games that involve destination, such as throwing and catching a ball, tracking a flashlight, etc. And this is more on the gross motor. For the fine motor activities, you could do dot to dot, cutting and pasting, and again, continue doing language activities as you do all these activities to follow directions, etc. Auditory processing is understanding what we hear. They hear the instructions, but they're not unable to follow them because they're engaged or preoccupied, maybe, or they simply do not have the right wiring. Our goal is to teach them to ignore irrelevant information. For auditory processing activities, we need to get them engaged first and then promote interactive activities.
The way you do this is giving them preferred activities, giving them a new toy, play in front of them, get in their faces. Also recognize environmental sounds, give them visuals, and simple one-step commands, one step at a time. Visual spatial processing skills is understanding what we see, making visual images of our thoughts. A problem that children might have is having difficulty transitioning to and from places and people, or even in familiar environments. They see the details, but they do not see the full picture. For example, they see the trees, but not the forest. Our goal is to decrease their anxiety by helping them modulate themselves in their own environment. Some of the activities that we could do is treasure hunts, obstacle course, what's missing worksheets, etc. Emotional modulation involves responding proportionately to an emotional stimulus. They become under responsive to environmental happenings, and that's when they cry, or when they see another child crying without no reason. They become anxious, or they overreact to things in the environment, or they have difficulty understanding feelings. They have frequent tantrums, and we need to regulate them. Emotional modulation activities will be keeping the child organized and teaching them to be emotionally mature. Give them positive emotional input while balancing input reactions. Symbolizing experiences and teaching them to communicate rather than having a tantrum.
So now that we talked about the roots of the learning tree, we're going to focus now on talking about the tree trunk. So this includes developmental milestones of shared attention, engagement, two-way communication, logical thinking, and all of these develop between the first 3.5 to 4 years of life. Okay, so these are the 6 core developmental stages, which I'll be talking about throughout the rest of the presentation. So the first stage is shared attention, and this stage involves regulation and interest in the world, with a child being calm and feeling well enough to attend to a caregiver and his or her surroundings, as well as have that shared attention with the caregiver. Here, the child may attend to multiple things in the environment while also ignoring the sound, let's say, of a fan or a phone. The child is able to filter out the irrelevant and focus on what is relevant. So this is dictated by their motivation. It's not something that is learned. And this shared attention strengthens like a muscle and works like a muscle. So the more we use it, the stronger it gets. Then we tend to generalize it and learn to attend to our environment. Okay, so stage 2 is engagement and relating. So here the child shows interest in another person and in the world, developing a special bond between a preferred caregiver. Here they also distinguish inanimate objects from people. The child builds an emotional connection with others, such as, let's say, making eye contact and facial expressions. And the person is the most relevant part of an activity, not the toy. So this is where the child starts to develop their communication skills. Stage 3 is two-way communication, which is also known as like a two-way intentional communication, which is a simple back and forth interaction between the child and a caregiver, such as, let's say, smiling, tickling, or anticipatory play. Greenspan mentions the communicative circles here. So let's say the child smiles, that opens the circle, and then you smile back, that closes that circle. It's important that the child is starting to like be initiative and assertive, which further leads to problem solving. Stage 4 is problem solving and continuous flow. So this involves a child using gestures, interaction, or language skills to indicate their needs and wants by getting a caregiver to help them with a problem. So let's say, for example, the child is like in a situation and they get somebody's help by taking their hand and leading them out of a room. There's a continuous flow, so they're using problem solving often, and further this will like make them realize that it is more efficient to communicate with words that symbolize ideas, and hence becoming a higher level communicator. Stage 5 is symbolic play. And here the child uses words, pictures, and symbols to communicate an intention or idea. They communicate ideas and thoughts, not just wants and needs. So as a child is starting to use more words, communication is improving. Stage 6 is logical thinking. So here the child is bridging ideas. It is the foundation of logic, reasoning, and emotional thinking, and a sense of reality. So here the child may be answering WH questions, making sense of dynamic things, being able to explain themselves, etc. In general, on each developmental level, regulation improves because we slowly become better communicators, hence becoming more emotionally mature. The 6 stages I have covered are important because after the age of 4, we start to move into an academic setting. This then leads to the formation of the tree branches, such as the child's academic skills, which I'll talk in the next few slides. So now we finished talking about the tree trunk. Now we start talking about the branches, which include written expression, social skills, math, reading comprehension, and abstract reasoning. Without the foundation of these 6 developmental levels, it is difficult for a child to do any of these things. Okay, so to conclude our presentation on the learning tree, we talked about establishing regulation, which were the roots, the developing through the levels, which was the trunk, and all of this equaling out to the academic and social success, which were the branches. When the child is missing the levels in the trunk, we see issues in behavior and social skills, and then as a therapist, we need to go back and fill in these holes. You may ask, what helps a child grow? Nurturing and a healthy environment, healthy food, emotional support, and positive relationships. So now we're going to present a pseudo case study that incorporates everything that we learned from the learning tree. So the assessment results show that the child is nonverbal. He communicates using physical directives, facial expressions, signs, and actions to communicate wants and needs. He signs approximately 7 signs: swing, more, eat, buy, all done, yes, and open, with assistance. He follows simple one-step commands. His hearing and auditory localization to auditory stimuli is within functional limits. He occasionally imitates others and demonstrates awareness of others in the environment. A calming effect was noted during vestibular input, at least the use of it. And he enjoys hugs and is affectionate, but he could be aggressive. Based on the results, we noted that the patient needs help to communicate more effectively, hence expression and comprehension, engage in joint attention with others, visually scan objects, stay self-regulated during functional play due to sensory, motor, and emotional dysfunction. Pay attention for 2 to 3 minutes because age appropriate is about a little over 30 minutes. Transition to or from persons and places. Identify basic concepts such as objects and actions by pointing. Decrease frequent emotional distress or sensory motor dysfunction. And socially interact with others using turn-taking and appropriately protest and gain attention. Based on what we have seen, the patient has learned to calm himself by using vestibular input, use covering his ears for self-regulation, and also to refuse actions and unexpected touch. He also walks away and cries and occasionally becomes aggressive when activity is not of his choice. And he nods yes for everything.
So some of the goals based on the assessment, some of the goals and treatment techniques that we could use is pragmatically 70% of the opportunities at least for him to engage in functional joint play with a family member or clinician. Also maintain nonverbal communication, 2 to 3 exchanges by looking at the speaker, passing back and forth a toy with the therapist while playing. Patient will stay organized also with a non-preferred activity by regulating inappropriate behavior with minimal support with the clinician. To assist the child doing all this pragmatically, we need to provide sensory appropriate environment, any activity that would elicit pressure, use cause and effect toys like hide the toy, then appear, tickle him, bounce, swinging, etc. You could also use gestures, tone of voice, and body language to increase positive emotion and decrease anxiety and get on child's face. Receptively, he should be able to follow two-step related verbal commands with some cues. Identify basic objects by visually scanning and pointing or offering them to the speaker. Strategies in order to do this is if child avoids or moves away, persist in your pursuit or use that magical tone that we all have. If child uses script, join in. Offer alternative scripting, change direction of the scripting. If child pushes or hits, provide effective no to assist in self-regulation. If visually distracted, avoid busy pictures and assist with scanning by following with your finger and or the child's finger itself. You use moving objects that are easy to scan, such as a balloon or bubbles. And you're able to grab it. Also use manipulators that make noises such as animal puzzles with sounds. Use objects and function pairing and then progress up to picture cards. Start with the easy, then you progress with picture cards that are more involved. Expressive goals could be increasing functional vocabulary by using 3 to 5 no signs, since it's not verbal, or ask for actions or objects by using 2 to 3 sequential signs, like I want more, or any other of the other signs that he uses. To do this, you could have the child with imitation and sequencing. Make sure that there's good eye contact and engagement first. Use hand over hand activities if needed. Pair visual and tactile or verbal cues. Use activities and objects that are enjoyable to the child. You give communicated choices if child is not responding.
And that's the end of our presentation. We hope you enjoyed and learned a lot about the learning tree. Thank you for watching.
Thank you.